There's been a big rise in the number of people in the UK who have died of coronavirus. 181 lost their lives in the past 24 hours, and more than 6,000 are now being treated in hospital. It comes as the Prime Minister and the Health Secretary have both tested positive for the virus. The government's Chief Medical Advisor, Professor Chris Whitty, is also self-isolating after displaying symptoms. In a video on social media, Boris Johnson said he currently has mild symptoms and will be working from home to lead the national fight back against coronavirus. The UK death toll has now reached 759 in just 3 weeks. Here's our chief political correspondent, Vicki Young.
Keeping their distance. Like many neighbours, the Prime Minister and Chancellor stepped outside to pay tribute to NHS staff last night. But 4 hours later, Boris Johnson tested positive for coronavirus.
I've taken a test that has come out positive, so I am working from home, I'm self-isolating, and that's entirely the right thing to do, but be in no doubt that I can continue, thanks to the wizardry of modern technology, to communicate with all my top team to lead the national fight back against coronavirus.
That top team has been spending less time in the same room this week. Cabinet was held remotely. The chief medical and scientific advisors were keeping further apart at online press conferences, but today Chris Whitty said he had symptoms and was self-isolating. Mr Johnson had his weekly audience with the Queen on the phone. In the Commons on Wednesday, there were fewer MPs at Prime Minister's questions, but ministers sat together on the front bench, including the Health Secretary. He developed coronavirus symptoms that night and is also in self-isolation.
I'll be continuing to do everything I can to get our carers the support that they need, and I'll be doing that from here, but with no less gusto.
With the Prime Minister unavailable, it fell to Michael Gove to take questions at the daily press conference.
The Prime Minister has coronavirus, the Health Secretary does as well, the Chief Medical Officer is in isolation. People will be looking at this and may be wondering whether you haven't been taking your own advice or you maybe acted too slowly when it came to stopping the spread of coronavirus.
The virus does not discriminate. We are all at risk, and that is why it is so important that we practice social distancing measures. Those are in place in government. Ministers are working remotely and from home using video conferencing in order to make sure that we can follow the strict advice that all of us should be following in order to help to protect the NHS.
Like every other workplace, Downing Street has been affected by staff absence. The Prime Minister's chief advisor, Dominic Cummings, is still up and running. Mr Johnson's girlfriend, who's pregnant, posted this photo of her and dog Dylan, saying self-isolating wasn't so bad.
Downing Street's emphasising that, like most people who get the virus, Boris Johnson has mild symptoms and is continuing to work. There has been speculation about who would take over if he can't take decisions. That would fall to the Foreign Secretary, Dominic Raab. But the message is clear tonight. The Prime Minister may not be out and about, but he's firmly in charge.
For the next 7 days, he'll stay in the office and flat in number 11 Downing Street. Meals will be left outside the door. Vicki Young, BBC News, Westminster.
The head of the NHS said tonight that staff would start being tested for coronavirus from next week, including critical care nurses, intensive care staff, ambulance workers and GPs. There's concern about the number of NHS staff currently off work because they're self-isolating with possible symptoms. Meanwhile, more preparations are being made to care for the thousands of patients expected over the next weeks. The Principality Stadium in Cardiff will be turned into a temporary hospital, providing 2,000 extra beds, as will conference centres in London, Birmingham and Manchester. Our medical correspondent Fergus Walsh reports.
This is what NHS frontline staff have been crying out for: swab tests for coronavirus. Several drive-through centres are being set up so that those isolating at home can find out if they or family members are infected.
This will be antigen testing, testing whether people currently have the disease, so that our health and social care workers can have security in the knowledge that they are safe to return to work if their test is negative. These tests will be trialled for people on the front line starting immediately, with hundreds to take place by the end of the weekend, dramatically scaling up next week.
Another key concern for NHS staff has been shortages of personal protective equipment. Huge stocks are being sent out from this warehouse near Glasgow, but many say they're still being left at risk, among them GPs.
People are really, really scared for themselves, for their teams and for patients, because they just don't know when they go in to see a patient whether or not, even though they're not displaying symptoms, they may still have the virus.
The rate of coronavirus infections is now doubling every 3 to 4 days. London is hardest hit. The mayor has warned that temporary mortuaries like this one in Westminster will need to be set up across the city.
I don't want to panic or alarm any of your viewers, but it's important all of us are ready for this, and we're doing our bit to make sure we're ready. But also, I'm really sorry to say this, you're going to see also us having to prepare for the possibility of huge numbers of deaths, and that's why we're working on the mortuary planning.
All non-urgent surgery is being suspended for 3 months as operating theatres are converted to makeshift intensive care units.
So I've got what they call locally advanced prostate cancer.
Chris Romney was due to have his prostate removed on Monday, but his cancer surgery has been cancelled.
I think it's morally and ethically wrong to sacrifice cancer patients in favour of COVID-19 patients, and it's so important that cancer patients don't become the forgotten victims of all this chaos that's taking place.
The hospital in Derby issued a statement saying, "We are continuing to prioritise emergency cancer treatment and full services will resume as soon as it's safe to do so."
Cancer specialists should have the opportunity with their patients to decide whether it is more risky for somebody to embark on treatment at this particular time, given that you are more vulnerable to infection.
If you want a sense of the scale of what's coming, look at the huge temporary hospitals being created for coronavirus patients. This one in London's Docklands will eventually have 4,000 beds. Another at the NEC in Birmingham will have 5,000. 1,000 more beds will be created at the GMEX Centre in Manchester. The NHS is bracing itself.
Well, Fergus joins me now. They are huge numbers you were talking about. Have we any idea yet? Are we getting a picture of how bad it could get in the UK?
Well, Sophie, I've been saying for months that the majority of people will get mild or moderate symptoms. It'll be like an unpleasant bout of flu, and that's still the case. But for the minority, the sheer numbers getting infected means that hospitals are going to be under increasing pressure, with cases doubling every few days. And I have to warn you that in the coming few weeks, the daily death toll will inevitably rise into the many hundreds. Now, it's vital when that happens that the public don't get downhearted and think that social distancing isn't working. It is working, but there will be a lag of 2 to 4 weeks before we see its effects. So as a nation, we have to hold our nerve, protect each other, because our individual actions will save lives.
Fergus Walsh, thank you.